Hi, welcome to the BIPOC Perioperative Leaders to Know 21 edition. My name is Carissa Brewster, and I'm the writer for Women Partners. And today's guest is Ebenezer Nkong. In a moment, Ebenezer will jump into questions, and that will take about 30 minutes. But to start, will you please introduce yourself, where you work, and at what facility?
Yes, good afternoon, Carissa. My name is Ebenezer Nkong. I'm currently a chief nurse for perioperative services at the Washington, D.C. VA Medical Center.
Awesome. Cool. So first question, what drew you into the medical field?
Well, so I got into the medical field because I wanted to contribute and make a difference in people's health during a time where they are most vulnerable in their life. So by choosing a career that is not only very challenging, but interesting and rewarding as well.
Awesome. Cool. In your experience, have you ever witnessed discrimination in the medical profession?
Yeah. So in the medical profession, I have come across different forms of discrimination.
Mm-hmm. And can you share an example of that and how it was handled?
Well, so I would say that there was a point in my career where I felt, that I wasn't giving an opportunity to promote. However, I didn't let that, put me down because I'm a firm believer in staying positive. So every time there is a negative situation, I always tend to uh, turn it into something positive. I find myself, I see myself as someone that has, I have extensive level of training and I'm very comfortable in my profession and in what I do. So when I see something that is negative, I try to turn it around by staying positive, and that actually encourages me to, to continue to stay focused and make progress in my career.
And do you think that kind of helps you professionally to have that positive mindset where if I'm dealing with this challenge, this will just help me?
Absolutely. So, like I said, I do feel like I'm very comfortable where I am in my career. I feel that I'm very knowledgeable, and when it's time for me to seek the right opportunity, I always go for the right opportunity or the next opportunity. So the example that I shared actually prepared me and enabled me to be where I am right now, which is very satisfying to me.
Nice. Cool. And do you have any concerns about the lack of diversity and inclusion in the OR?
Yes. So unfortunately, there is a lot of that, and when that happens, it does impact business because the organization is not able to retain or to recruit and retain a diverse group of clientele. So it is good when clients or patients come into a facility and they feel that the folks that are taking care of them are someone like them, sort of. So when an organization doesn't plan or invest in recruiting a diverse group of staff, I think it actually impacts them negatively.
Right, right. What do you think organizations, for instance, like Whitman, recruiting firms, talent acquisition folks, what can we do to improve that, in your opinion?
Well, I think that for you guys, where you come in as try to is to gather and share some data, right? And also uh presenting data to the C-suite folks, to the leadership of the organizations that you are helping. You can also help by creating and advising organizations to create a mentorship program, and also offer a career coaching for potential talented staff within the organization, so that it can be prepared to and be ready to assume the next level in their career or to experience growth within their career. Because when you have staff in the organization that are very experienced, that is organizational knowledge, and when this staff when they don't have the opportunity to advance or grow, that leads to them seeking opportunities in other organizations. And it could also be very detrimental, because if that staff is well respected within the organization and they are informal leader within the organization, when they depart from the organization, they not only take away knowledge of the organization, but they also sometimes can attract other staff that respect or believe in them to wherever they go. And that is an example that has happened to me.
Yeah. Going back to like the patient experience of when someone goes to the hospital to be treated and the knot might loosen when they see someone like them. Do you feel like the C-suite or leadership understands how incredibly important that is?
Unfortunately, I would say in my experience, not really. You find sometimes examples of, it just depends on the leader, but and I've had to work in organizations where some of the C-suite leadership team really supported me. But then you had the kingmakers, for instance, in terms of nursing, you know, do not realize that. And when I say the leadership, I will make an example. I'm referencing like surgeon leadership or that I work with. But the nursing leadership sometimes have not always seen, have that vision. I find that they've been very focused on ego, and sometimes I probably would conclude that sometimes have not really cared about, that issue of diversity.
Mm-hmm. Yeah, I feel like, the patient experience is really important, and how they feel it can contribute to their well-being and even just getting better with whatever.
Yeah, absolutely. It's very critical. When you come into a hospital, for instance, where depending on where the hospital is also located, you would see a very diverse, probably downtown inner city, where the population and the client base is very diverse. But then when you come into the staff that are actually providing the services, and you don't see that diversity, and also there is a lack of trust sometimes.
Mm-hmm.
So that definitely negatively impacts patient experience.
Right. What is your advice for upcoming perioperative leaders who are BIPOC?
Well, so my advice is for them, one is to really be engaged in their profession, be prepared, gain experience, get the right education, and also seek a mentor. They need to seek a mentor. They need to join like their professional organizations and seek out a mentor. In some cases, some organizations, if you actually bring suggest to your leadership that you would like to have a career mentor, or you would like some career coaching. Some organizations will sponsor that. So I would advise future potential people to really invest in themselves, gain experience, and also prepare themselves educationally to be ready to take the next leap when the opportunity arises.
Mm-hmm. Um, right now with COVID, we're dealing with the Delta surge,
Mm-hmm.
and part of the cause is low vaccination rates among different populations, but particularly with the Black community, there is some vaccine hesitation. Um, what are your thoughts, and what are some suggestions you have on tackling that issue, specifically within the Black community?
Well, I can tell you specifically some of the things that I have done within my organization. So, and also as part of the executive team. So what we do is when you come into an organization, you have informal leaders, right? So you seek the informal leaders that are respected within the organization. You look at the union leadership also within the organization, and you ensure that they are well trained about the science of the vaccine and also the myth, because what is happening with a lot of the minority populations is that there's some historical perspective to vaccines. So what we need to do is a lot of sensitization, education of the informal leaders to be able to reassure the rest of the staff that the vaccine is actually safe. And Personally, I've had situations where staff has actually reached out to me and asked me if I had taken the vaccine and what I thought about it. And I'm sharing my experience. I mean, I had the vaccine back in February when my organization just launched the vaccine. When I shared my experience with them, a lot of them had felt reassured and actually went ahead and took the vaccine.
So it just took them talking to you about
Yeah,
it.
you need to talk to them. You need to identify, like I said, my level is pretty senior, but you need to identify, like, at a lower level, informal leaders amongst the staff and provide some education to them so they can lead with, coaching or sensitizing the staff to be comfortable taking the vaccine based on the science.
Mm-hmm. Yeah, there's a lot of, science and medical miseducation.
Mhm.
Um, what are your thoughts about that? Like for the individual that talked to you, it just took talking to you to convince them to get the vaccine. Like, how do you go further with someone that's like, yeah, I don't know. I read this or I saw this. Like the misinformation is just so rampant.
Right. So what happens is that, like for me in my organization, when this COVID started, we had an incident command center, right? I'm part of the leadership team. I do get daily briefings from the infection control practitioners within my organization. And also as a healthcare professional, I have access. So you would reference them to like the CDC where the right sources are, because there's a lot of, like you said, misinformation out there. So you want to coach them to go to the right source to get the information from the right source, right? And share the science with them.
Yeah. Yes. Um, so last question is a fun question. So do you have any favorite books or a current book that you just read that inspired you with your leadership? It could be fiction or nonfiction. It could feature BIPOC experience or not.
Well, so for me, the book that has inspired me a lot within my career as a book called The 7 Habits of Highly Effective People. That's the book that I read. I continue to make reference to that book, and it has helped me. So that's the book that recently, I haven't really read any book because I have 2 toddlers and I'm mostly focused on toddler programming and
Yeah.
information, and yes, so.
Yeah. Awesome. Well, thank you, Ebenezer, for joining us today. I want to thank you for all the hard work that you're doing. I think healthcare workers are just our unsung heroes during this pandemic, and just appreciate what you're doing.
Absolutely. I'm very thrilled to be in the healthcare setting. Also, just to add, I'm also a Navy reservist, and I had the opportunity to be deployed to New York City, where all what you saw on TV about New York was occurring. So we took care of a lot of patients out there, and I was really thrilled to be part of that mission.
Oh, and this was early in the pandemic.
Yes.
That must have been
That's,
intense.
yeah, so I was in New York City at the Jarvis Convention Center for 2 months, I think, from April to June
Mm-hmm.
2020. Yeah.
Oh, thank you. Thank you so much. You have a great day, and we'll talk to you soon.
Thank you. Bye-bye.